Now, one of the most clinically important use of the muscarinic agonist is in the eyes. Okay, so this parasympathetic nerve innervates the particular what we call as a constrictor muscle of this iris, whereby they can lead towards the pupil constrictions. We call it as a meiosis as well. Okay, and the ciliary body as well, it can cause the lens to thicken for a near vision's accommodations. So a classic drugs here, we can use pilocarpines. So this pilocarpine basically they use to treat glaucoma. It's a part of the disease, okay, in the eyes because of the intraocular pressure. So this intraocular pressure can cause the pressure and then they can damage the particular eyes as well. Okay, so we can give pilocarpines, whereby what it does is by enhancing the outflow of the aqueous humors through the canals of. So they're able to help to relieve the pressure of the optic nerve. While these muscarinic agonists also, they may sound like a simple mimic of acetylcholine, whereby they can actually become a very powerful therapeutics to act in the systematically as well. Okay, so in other hand, we can use it for the parasympathetic activity in a target for a clinical benefits. Okay, now let's flip and switch and look at the muscarinic antagonist. Just now we talked about the agonist, now we'll talk about the antagonist. Antagonist, that means to block it. Okay, so it's also known as parasympathetic lytics, whereby it's initially, as I mentioned just now, the name of the antagonist, basically we want to block the actions of the acetylcholines at the muscarinic receptor. So when we talk about acetylcholines, so you have to remember about muscarinic. So when we talk about the antagonist, you have to remember about blocking. Okay, so this drug are the chemical that opposite between the muscarinic agonists. So they're able to inhibit the parasympathetic response throughout the body system. So they have two classical example. Okay, just now we also have one things we call as atropines, and we also have the scopolamine as well. Okay, so this scopolamine basically they are derived from a plants. Okay, this kind of plants. Sorry, I need to open the laser. So they are derived from the plants, whereby this plant basically they able to control and giving some of the effects towards the parasympathetic lytic as well. Okay, so instead of like you have to remember that parasympathetic basically they cause vasodilations, but over here they can cause vasoconstriction. So it's quite a dangerous and can be a poisonous as well. Okay, just now we talked about some of the plants that have become a poison as well. Okay, so for example of the drugs that we can look at is the atropines. Okay, so the atropine basically they have a very wide range of the physiological effects by competitively blocking the muscarinic receptor. So in the exocrine gland, basically they inhibits the secretions, whereby they can lead towards the dry mouth, reduce of your gastrointestinal and the bronchial secretion. So they are opposites, okay, of the rest and digest mechanism. So on the cardiovascular system, it can on a moderate dose of this atropine, they can cause tachycardia. Okay, so it can also remove some of the vagal tones of your heart, and a low dose basically they can even cause a bradycardia as well. Okay, so this is because of the central effects. So if let's say we're looking at the eye, so it can cause your pupil to be dilated, and then we can also part of it can become pupil dilations, and then in the paralysis cases, they have a salivary of your muscle impairing with the near vision as well. Okay, so for smooth muscle, the atropine can relax the gastrointestinal and your urinary tract. So in this case, they can slow down the motilities and providing some of the relief in the spasmodic condition. For example, like people having irritable bowels or having an overreactive bladder as well. So actually this muscarinic antagonist, for example over here, if let's say some people who are always need to go to the toilet, so they need to have a very active bladder, another way. So we can give this medication, okay, to reduce the parasympathetic mechanism as well. Okay, well, in CNS system, like muscarinic antagonists, for example, like the atropines, so they can stimulate or become a sedative effects. Okay, well, it really depends on the dose and the context as well, whereby this explains why these chloroquines, they can be used as a motion sickness. Okay, so we can use this scleropine basically used as for motion sickness, while a high dose of this atropine, they can cause hallucination as well. So these muscarinic antagonists, they can be act as to silence your parasympathetic signal. Okay, so making them quite a therapeutic, useful in setting where you want to dry, relax, and having a slow down physiological response as well. Okay, otherwise it can be driven by the acetylcholines. So now we try to explore on the another branch of the autonomics pharmacology, whereby they involve the drugs to either stimulate or to block your autonomic ganglia as well. So whereby they kind of like relay stations of your sympathetic and parasympathetic nervous system. So first we look at these ganglion stimulating drugs, for example like your nicotines and the diamines peperonisms, okay, DMPP, so whereby they can act as a nicotinic acetylcholine receptor agonist, so they can against the nicotinins SCH as well, whereby they can stimulate some of the receptor that found in the autonomic ganglia or in your neuromuscular junction as well. So these particular drugs, they can activate both sympathetic and parasympathetic ganglia as well. So they can affect in a very high complex and sometimes can be contradictory as well. For instance, if let's say the stimulations can cause the tachycardia, and then they can also increase the blood pressure due to the sympathetic outcome, but they may also stimulate some of the salivary and bronchial secretion. Okay, if let's say we always talk about tachycardia, high blood pressure, then you will recalls that basically they're having stressful environment, right? Parasympathetic antagonists. But now we are coupled with the stimulants of the salivary, and even they have this bronchial secretion as well, whereby this is a parasympathetic activation. So you can see in these nicotinins, or what we call as a DMPP, basically they can activate both way. They can activate your parasympathetic and they can activate your sympathetic mechanism as well. So their impact, it can cause the gastrointestinal motilities and the secretion as well. So depending on the dominance of either your autonomic division in the particular target tissue, so they have a dual effect on another way. So in contrast with your ganglion blocking drugs, for example, they can be act to suppress the transmissions of your autonomic ganglia. We can silencing both sympathetic and parasympathetic output as well. Okay, just now to enhance both parasympathetic and sympathetic, but in ganglion blocking drugs, basically they can silence both sympathetic and parasympathetic output. So for example, agents like the botulinum toxin, okay, and we also have these hemiliniums as well. So they're able to inhibit your acetylcholine release. So a part of it, we can also have a more persistent of these depolarizing block at this nicotinin receptor as well. So the consequence of these ganglions blockage are more systematic, and they can cause hypotension, loss of your cardiovascular reflex, and they can also inhibit some of the secretion. For example, like your gastrointestinal paralysis. Okay, so they can even cause towards your impair of your bladder function as well. A part of it also, they can affect both divisions of the autonomic nervous system. Because of the lack of this selectivity needs for the safe clinical use. So therefore, most of the experimental interest is focusing on this ganglion blocking drug as well. Okay, still they remains kind of like a research tool for us because we want to understand how does the autonomic regulations maintains the homeostasis and what happened when the balance of this pharmacological have been disrupted. So currently we are still doing investigations on this ganglion blocking drug as well. Okay, so we don't have any prominent clinical use for time rings.